After concentrating their efforts on rapid live virus testing, all AFC Urgent Care locations are seeing patients, including Burlington.
Earlier on during the pandemic, we saw 30 to 35% positive in the patients that we were testing. And now we're testing a wide group of people, both symptomatic, asymptomatic, patients that are traveling, and patients who are pre-procedural. And so overall, we're seeing a much lower percentage of COVID positivity.
While research continues on a COVID-19 vaccine, medicine is investigating COVID antibodies.
So there's a lot of reasons patients would like antibody testing at this point, and the confusing thing about antibody testing is that there's a lot we don't know yet, and I suspect that over the next 2 to 3 months science will kind of unfold some of more information that may be useful to us. But many patients were sick back in December, January, and February with a flu-like illness and may have tested negative for flu and are suspicious that they may have had COVID at that time. Now, if you were to get an antibody test and you were in fact sick several months ago with COVID, that presumably should be positive, and so many patients just kind of want to know. Other reasons that patients want antibody testing is because of convalescent plasma donation. So what we're finding now is that one therapy for very sick patients in the hospital is convalescent plasma transfusion. If a patient has tested positive with antibodies and has had COVID and they've had a positive test in the past, they are a candidate to donate their blood at the Red Cross for possible plasma transfusion, and that may be very helpful to somebody who's in need.
Being tested for antibodies is a simple process.
So what happens here at AFC is they'll call into our center and they will get telescreened by a provider, and they will come in during their appointment time and have 2 tests. One will be a rapid live virus nasal test, which is required for any patient that also wants antibody testing. And that's just a gentle nasal swab. It's not painful. It doesn't go all the way back like some other tests do. And then secondarily, they will be brought into our treatment facility here and they'll have a venous blood draw. So it's a stick in the arm and they'll have that drawn. That antibody test takes about 48 hours to return from the lab. The rapid live virus test is resulted within 15 minutes and we'll call the patient same day with that result.
Even after a vaccine is found, the precautions of COVID may be with us for years to come. So please follow recommended use of masks and social distancing safeguards. From AFC Urgent Care in Burlington, I'm BNEWS reporter Tad Stefanak.